Welcome to the West Middlesex Hospital Emergency Department induction video for new locum doctors. This video will give you a brief tour of the department and provide you with the details you need to navigate your first shift safely and confidently. When you start your shift, it is important to introduce yourself to the team's nurse in charge and registrar in charge. Please remember to introduce yourself to the consultant on the shop floor. They are seated in Majors A. The registrar in charge will give you your smart card and login codes and can answer any questions you might have. For questions about booking in shifts, speak to our line manager, whose office is in the staff area. If you need an access badge, please visit security in the main hospital entrance with an ID as deposit. In the staff area, there are male and female changing rooms with staff toilets. There is the tea room, equipped with comfy sofas, a massage chair, microwaves, and fridges. There are 7 main areas in our emergency department: resus, majors A, B, and C, pediatrics, the clinical decisions unit, and the observations bay. Patients brought in by ambulance under blue light are received directly in resus. We have 3 adult bays and 1 pediatric bay. In resus, you will find the difficult airway trolley, emergency resus trolleys in each bay, collar and blocks, trauma mattresses, trolleys for cannulation or blood cultures, medication cupboards, ABG machines, a fridge for medication, and the portable X-ray machine. If you are unsure about where to find equipment, please ask the staff nurses, who will be more than happy to help you out. Patients streamed by the urgent care centre or brought in by ambulance are seen in majors areas A, B, and C. Patients are primarily seen in the triage rooms and then assigned a cubicle. Majors A consists of 8 cubicles in 2 side rooms. Each side room contains a gynae trolley. Aside from a bed and monitor, you will find cupboards containing equipment for cannulation, oxygen mask, sick bowls, and urine pots. Please take some time to familiarize yourself with the contents of a cubicle when you first start. In Majors A, you will also find the bladder scanner, the ultrasound machine, Antonox and oxygen cupboard, screens indicating arrival of ambulances, and performers and guidelines and other paperwork you will need for investigations and treating. Examples include the safeguarding guideline, performers for trauma calls or CT head requests. Majors B contains another 8 cubicles. Please go to the stockroom for cannulation equipment, sharps boxes, linen, and other trolleys such as the catheter trolley, wound care and minor injuries trolley, and the nebulizer trolley. There is a resus trolley located in cubicle 18. There are 2 psych rooms specifically designed to host patients presenting with mental health complaints. Please notify the RMN if you're bringing a patient in. Major C contains 5 cubicles and 4 side rooms. In the stockroom, you will find 2 ABG machines and trolleys for cannulation, catheters, ENT, nebulizers, and gynae equipment. There are sluices where you can find urinalysis machines and pregnancy tests in Major C and near the triage rooms between Majors A and B. Pediatrics is a separate area with 7 cubicles and 2 side rooms. You can find linen and medical equipment in the cupboards and trolleys. Relevant forms and paperwork for pediatrics can be found in the nurses' station. Please ask the pediatric nurses for help if you can't find what you're looking for. The Clinical Decisions Unit is a type of waiting room for patients who are likely going home but still waiting for results or repeat tests. The Observations Bay is reserved for more frail patients who need additional investigations, need to be reviewed by OTPT before discharge, or who are unsafe to discharge out of hours and need to await transport. X-ray and CT can be found down the corridor from the department. Last but not least, we have the stockroom, where you can find catheters, ENT tools, speculums, and more. Take a look yourself if you have time. It is found between Majors B and CDU. The tannoy system is used to announce priority calls and requests for porters, domestics, or doctors. You'll find them in all areas. There are emergency pull switches in all cubicles which trigger an alarm. These are used in case of patient emergency. There are also red security buttons under the desks that are used to call security to the area. Now that you're familiar with the department, you can start seeing patients. We use Cerner Electronic Patient Record to view previous notes and input our observations in clerking. We recommend, time permitting, that you observe another doctor using Cerner EPR to familiarize yourself with its use. ICE is used to request imaging, bloods, referrals, and can be used to view blood results. Sectra PACS is used to view imaging. On the Trust intranet, you can find antimicrobial guidelines, guidelines for VTE prophylaxis and treatment, safeguarding pathways, the ACS pathway, and pediatric guidelines. Don't forget to use the POD system to send the printout request and labeled bloods. If your patient needs to be transferred to imaging, please place a request in the Porter box. You can get in touch with members of other departments by bleeping them. Simply input 8, the 3-digit bleep, followed by the 4-digit phone number you're using to call, and press OK or hash. Now you should be ready to get started. Please remember to pick up our cheat sheet with written induction information and most used bleep numbers before you begin. Please remember to complete the locum induction survey before getting your first shift signed off. Thank you for watching.